and tells us, you know, it's my turn or I am. No, you must be going in there to make things right. Each of us, we have a responsibility. Locally, we need to understand our responsibility when it comes to me and my household expenses and what I do in terms of paying, if possible, for the health of myself and my family. And so that's why I say it's a collective responsibility. We shall be dealing with this on the stage. I am passionate. As a public health physician, I feel specially committed to this. I thank you.
Thank you so much. Thank you so much, Doctor. And yes, I believe that every one of us here, the human connection in the room and to the subject matter clearly is one that has us in that same place and that strength of emotional will. We're talking about the fact that we do have to make things right by the power of our legislative might and affirmative, deliberate, connected, how do you put it, universalism of progressive action for this. Well, without any question, Dr. Dan Fulani, you're the man on the hot seat here today. Not only do you have to defend, explain, clarify, you also have to give us what, on behalf of government's very deliberate action, is going to be a commitment to making a change.
Yeah, thank you
and
very
a plan
much.
of action.
Thank you very much. For the involvement of informal sector in the health insurance is there. Even my own FCT health insurance, register individual for as small as 13,500 naira for a whole year. Now, there are challenges with the healthcare providers. Let's face facts. If you go to a hospital, you may meet a left-handed desk officer who will tell you that this is not covered, that's not covered. It is not true. There is a benefit package which we encourage everybody to go through and understand, at least for some of us that can read and understand. If you go to a hospital, you know what your rights are. Somebody just talked about bill of right that a lot of people don't know. A lot of us don't know what our rights are. You can't go to a hospital and somebody will tell you it is not covered, this is not covered, that is not covered. If we know as regulator, there are instances that we have had to remove such hospitals from our list. So this is a challenge from the healthcare providers. Even the enrollees too have their own challenges. Some of them will go and bring the son of their relative and take to the hospital to go and access services for somebody that they have not paid for. Somebody will collect money. Imagine an enrollee will collect money from somebody he doesn't know and say, use my file to get drugs. So these are ills in the health insurance landscape. But I'm not bothered because I know we are just starting. We are talking about not more than maybe 5% of the entire country already on health insurance. And that's the story of universal health coverage. Everybody must be on this. So for some of you that cannot pay for 3, you can come to FCT Health Insurance and do this. Now, I can now use my opportunity to say what I have to say concerning my feel about the uptake of service and access to healthcare delivery in the country. The first challenge that always faced my mind is that Nigeria is a beautiful country. Nigeria has a lot of high-level specialists. Nigeria has everything it takes to be one of the leaders in the world. I'm not overemphasizing this. If you look at the qualities of every other things we do in Nigeria, it's wonderful. If you go abroad, some of your colleagues abroad, imagine Nigerians abroad, what they are doing. So I cannot understand why all the health indices, Nigeria is second, is either we are the last or we are second to the last, or things that are unheard of. Sometimes I'm tempted to think that maybe these people are just lying, that these things are not true. So why? Why are we having that terrible situation? The simple answer is what everybody have said here today. We do not prioritize health in this country. Our leaders do not prioritize health in this country. Our legislators do not prioritize health in this country. Otherwise, how do you interpret Abuja Declaration that every country must capture in their budget nothing less than 15% of their budget. Abuja declaration, I'm talking about Abuja here. Whereas that country where this affirmation was made, Adelaide will you get 4%, Adelaide will you get 8%, Adelaide will you get 10%. Why? Why? Then, when you look at the budgetary allocation in this country, all of us were aware. First, the budget is late. 2, there is usually utilization deficit. 3, the third factor, mismanagement. So at the end of the day, if 5 naira is actually allocated to health in this country, if you get 1 naira to be expended, you are lucky. We all know this. Why are we not saying the facts? We don't need any special contractor or any special project person to tell us all of this. I agree that the primary health care center, which is the bedrock of any health care anywhere in the world, is nowhere to be found in this country. Let's not forget that primary health care center is not talking to the building alone. It's talking to services. If you see what, just Google it, primary health care center in UK, in US, see the building they are calling primary health care center. So, in Nigeria, smelling small dilapidated building with bushes around, rat invested, is synonymous with primary health care center in Nigeria. It is wrong. It is the duty of all of us seated in this hall to say that this is not correct. Now, if we all agree that 60% of the masses lives in the rural area, and that 60% of the available healthcare facilities are in the urban area, so what are we saying? So access to basic care is not there. So we need to tell ourselves, just like she has said, everybody must be willing to ask questions. We must hold our legislature responsible. We must hold our leaders responsible. Even if we don't expect government to bring all the funding, the policy direction, political buy-in, legislation and supervisions, basically government should be able to give us this. Until we do that, universal health coverage in Nigeria will still going to be a mirage. Thank you very much.
Thank you very much. Well, there's so much to say. It's not just from the position of explanations. Please, let's appreciate once again Dr. Danfodali. Thank you very much. So we know that the issue is what it is. They're real and they're hot. And the thing is, when there is a fire, how do you put out the fire without endangering an entire forest or institutional architecture? And this is where we are looking at solutions. I was just asking Auntie Mojuma Konjola that how did we get here to a state where a nation of great minds, like you had stated, has come to such a great colossal challenge with something so significantly a priority of reference for nation and for generational preservation. Yes, ma'am. I know you have to make your comment and leave immediately because today is 32 years of NAWAJ, and she is a goodwill speaker there as well. So yes, very quickly.
Thank you very much. Very quickly, I want to speak to creation of awareness.
Yes.
We are not aware of things that we can actually plug into. And I think all of us here agree that we need to create more awareness, aggressive awareness. And that's where partnership comes into play. Sage, I'm happy the way you spoke, Doctor. I just want to say here that we have something coming up. It's a movement. It's called the UHC 2023. There is no place in the world where there are sane people, and I want to believe that we have sane people in Nigeria, that we will not take advantage of the political campaigns coming in. We need to start, asking our politicians, what do they really understand when we talk about health? For them, some of them, with what we've heard, is the provision of hospitals, but will the hospitals themselves become services for people? Have they thought about the operational needs of providing healthcare delivery service to Nigeria? And these are things that we should start partnering with each other. We must be bold enough to ask our governor. One governor came on a national television and proudly said, I give 500 naira to, to women when they have their babies. Yes, it's on channels. You can Google it. I'm not, it's not, and my heart bled that what kind of a governor would come and say proudly that I give 500 or whatever amount he said he gave. Is that, oh, I don't know, is that what 5,000 there, whatever. But 500, is that what that woman needs at that time? A woman that will have to go through cesarean, how much will that cost? So we are looking at that as well. And again, we must be able, please, to accentuate successes where they exist, so that it can become a competition among states. If any state is doing well, and let the media know. The media has an association of health correspondents. If you Google, you will find them there. I'm part of them. We must know where it is working, so that we can, because we have now become a country of complainants. We're not ready to work for solution. And just like Dr. Uchenna said, it is a collective responsibility to get it right. And I say this with every emotion in me. There's no hospital in the world, big hospitals, that God has not given me the privilege to visit. And there is no place of specialization that I have not found in Nigeria. If we can do it elsewhere, let's do it at home. I'm not a supporter of this one-stop health outreach and then there's no follow-up. I hope that this foundation will be one that will follow up on cases. When we go to operate a woman or operate the eye, we must have provision for follow-ups. I have seen where there are no follow-ups, people have lost.
Committed to having a meeting and a conversation that carries this forward from here through an activation that takes us to the place of positioning this in as a legislative position. Antimoji and Dr. Club 12, can we agree? Please, can you still put up your hands so that, and anybody who wants to join that team, because we make it an immediate action group. Thank you very much. The father of primary health care, please keep your hands up, please keep your hands up, please, very quickly. Could someone go around and just get it? Please, we just start with a critical mass, no matter how small, it is enough. And talking about small, earlier on when the keynote speaker, the CEO of FCCPC, Babatunde Irukera, came in, he said, this effort today succeeds from the very beginning. It is not an event. There is an urgency we must all focus on. If we save one life, we've succeeded in saving all lives. And therefore, this is not about something small, because just like we've heard it said, it's a collective responsibility for everyone, health for all. I would now like to take this, please, has everyone who's indicated, so that we have your names, just so we can get that going forward. Thank you. Thank you very much. It begins here, because passion without action is just a waste of all of the expression. So please, let's make sure that we're moving forward. Well, we've heard from Dr. Dan Finali, and I know fully well at this point, I'm going to come this way around, sir, because I believe that I would like to hear Dr. Uchenna give his own closing remarks at the end of all of the remarks here. So please, Dr. Haruna Daniel, your own interventions as a wrap-up from what you've heard on the subject matter, and we're looking at solutions.
Okay, for me, I think it's high time that we as Nigerians, not as government, because for me, from what I've seen, from the place I've been, I think it's high time for we as Nigerians to take our health in our hands.
Take our health in our hands. All right.
Just because when we are going to wait for the government to do budget and then serve us, it will never be possible anymore. Just
all
like
right, I'd like to challenge you here at this point. If we look at the hands are made up of these 5. So I'd like a 5-digit approach. Number 1, awareness.
Number one, yes, we need to create awareness, particularly to
Please, who's my
everybody.
rapporteur here taking note of this? Number one is awareness. Number two,
We need to find a way to support health interventions in the rural.
all right, so we are looking for support strategies for this. Number three,
Then we need people, we need communities to own their own health system.
so identify communities and in which we can situate or domicile, whatever the action is.
Then we need also the community to also find a way to have access to health for themselves.
All right, so we should profile access, both in terms of its soft approach, frameworks, and the
And-
physical locations.
Structurally or not structurally, there should be a way that you should get those interventions in those communities.
There should be a way to,
To get those interventions in the communities. It's not that there must be a PhD built, but if health interventions could be.
so door to door, we're going to the doors.
Yes.
We're taking the
Yes,
service
door. We
to
shouldn't
the underserved
Yes.
in their communities. How did His Excellency the Ambassador put it? He said, in your days, it was the domiciliary. It was a domiciliary approach. And like we saw it so beautifully illustrated in the documentary, like the lives of the community was directly impacted by restraining them in their households to wait until the intervention came to their hands, to their doorsteps, and that was the contact. So there it is. Thank you very much. A 5-digit approach. Can we call it the 5-digit approach from the FFU? Thank you very much. Next, sir. In terms of activism now, we're looking at it from the position legislative action, because this is key. This is absolutely key. It's what unlocks everything. But what is the principle? I mean, you spoke about it, whether it's from, how do you put it, chapter 2 all the way to chapter 4. What needs to happen in those chapters? Scale.
Yeah, the Bill of Rights is not an act, so we need to make it a legislation.
We need to make it a legislation.
And somebody asked here, how can we all work together to make this? So what I would suggest is the National Human Rights Commission is ready to partner with the foundation,
Thank you.
as well as the consumer protection and other stakeholders.
Thank you.
We can come together, and the way is we try and get a consultant and have a draft legislation
put together.
that will capture these gaps we have all talked about here. Then we critique it, and then we involve the relevant committees in the National Assembly for Health, both at the Senate and House of Reps, and also the Human Rights Committee, which
Thank you very much,
have
sir.
a stranglehold. And one of them will sponsor it as a bill in Parliament, and we can then see it through.
So can we agree here and now that you're heading that, and how many of us are joining this team right now? Can you please put up your hands? If you're a lawyer here or somebody who just wants to join that, okay, please, very quickly. So that for this, in taking it from where we are right now, from this platform to a platform of action, actionable results. So the first meeting would be when, sir?
We can do it right here before I leave now.
Okay, before he leaves right here, so we're going to have...
I would like to know those who are interested.
Thank you. So who's interested? Very quickly, please put up
Those
your
who are
hands.
interested in a legislation to take care of these gaps and
Very
make sure
sure.
that we create more
Please, where are the
access.
ushers? Very quickly to go around. Please, ushers, quickly, please. Everybody's hands up. Ready for this. This is for translating all of our passionate ideas into a very deliberate intervention.
And I want to take
Madam Sage Barrister, you're not doctor, you're not joining.
I want to take
Why
something.
are you disheartened? You don't believe it will work? Too many things happening for you. Can you delegate somebody from Sage and from Club 12 to do that? Because you cannot have spoken so loudly in this room. It's one thing to be a voice for the voiceless, but I found that it's more critical to be a voice, a visible voice for voices speaking. These are voices speaking. They need attenuation. It needs to be amplified. We need a support structure for his commitment. Please, I need people to commit. Okay, let me challenge everyone in this room. Who lives in FCT here? How many of us live in the Federal Capital Territory? Hands up, please. If you live in the FCT, please put up your hands. Can I see you very quickly? Very, very quickly. Who doesn't live in FCT? Who doesn't? Fine. Local government elections were last week or 2 weeks ago. How many of us went out to vote? put up your hands. Do you see why we cannot change anything? And now in this room, it's not about voting, it's about acting. Please, I demand that we have an action group. Sir, your team, please put up your hands now. Delegate if you have to delegate, but please, please join this decision. We're doing this for the memory of Francis and Mommy Felicia Umenyi. And his advocacy lives on today. Thank you. Have we got our representation? We don't need too many, actually, but we just need enough. So, yes, sir, I can see, sir, at the back there, yes, 2. There was someone here who was putting up their hands. 3, 4, great. I have 4. Anybody else on this side? 5. Anybody at the center of the room? 6.
I nominate Ambassador to be part of that team.
You are yes, exactly, because you're right. Sir, we would like to respectfully ask you there. I think once we have 6, we are okay.
Yeah, sure.
Please. So immediately after the meeting, he's going to be meeting with you and we have the next steps going forward.
But if I can just have 1 more minute.
Yes, sir.
I just want to make the point that health insurance at the rural level is key. And we cannot have enough primary health care centers by the government.
Yes.
We must involve the private sector, because you may have only 1 primary health care in the world, but you can have up to 10 clinics or hospitals in the world. So any system that doesn't involve the utilization of the existing mechanisms like the hospitals and health centers is not going to work, because we are not going to just have only government providing, if we really want to give access. The private hospital level, and maybe Dr. Damfulani can tell us how we can do that.
All right.
I believe it's key to success at the grassroots level.
Thank you very much, my distinguished Esquire Anthony Ojukwu, and he is the Executive Secretary of the National Human Rights Commission. Today, like you have said it, and actually Martha Levitt referred to it, that there's an opportunity for the adopt a family at the state health insurance scheme level. You can adopt a family, and working the teams from hands-on to on-site to all of us becoming team-oriented. There is a dream here that the legacy of this foundation is flying, but it takes a team to make a dream work. And if we are in this room, you've already become part of that dream becoming a real experiential delivery as a reformed and transformed healthcare utility and system. So the only way to make a difference is to be holistic and to create our ward levels at global access platforms. Thank you very much, sir. Well, Doc, over to you. And his philosophy. He's the philosopher on the panel.
Thank you very much.
Yes, sir.
I just wanted to start by saying that I akin our conversations, speaking to the issues like an iceberg. For those who know about the iceberg phenomenon, what you see on the surface is just a tip of the bigger issues. So what you see in the facilities, it's just so much less than what is really happening. In the community, you see the real problems. Yes, there's need for us to focus on the facilities and get things right. And even at the facility level, like I said at the beginning, the primary health care centers have a gatekeeping function. That is the issue we have with our system. And with like every system, there are people, there are structures, and there are processes. We've put up the structures, some of them dilapidated. We have the people, maybe maldistributed. There may well be some system issues. It's for us to have all these groups to answer. And the ambassador also said something which I wanted to answer, if you permit me. He talked about healthcare providers between the nurses and the doctors. There's a book called Where There Is No Doctor. It speaks to these health cadres. And it started all from the times of the ransom cooties. And these are still there. The community health workers, they choose, the junior choose, name them. They are there. But are they in the right numbers? Are they well motivated? Are they properly distributed? We need to answer those questions. But I dare say here, the answer to this, for us to get to our set targets UHC level, I feel embarrassed I spent most of my life working outside the country, and I've seen our sister African countries have better indices. When you come back to your backyard, you see some not very interesting figures. Is there something we can do? 1,000 times yes. We need to start re-engineering our PACs. Let them get back to that gatekeeping function. Some of them have already been mentioned. We need to reset ourselves. In our thinking, in our drive, I look forward to the day where we can recall a senator at the Senate chambers, they call it the red chambers, from that red chambers on account of the health indices in his constituency. Can we get there? That's what we should be thinking about. Not until there is a consequence for action and inaction on the part of our leaders. It's all shoot, talking about these issues, and we'll probably have this talk yet again. People have to be held accountable, regardless of who they are. We need to also revamp the intersectoral collaboration. There's a lot of untapped resource out there. The private sector, they are there. Those in diaspora, they will tell you their experiences, what they want to do here. If you have a good child out there, a good resource, wouldn't you just plug in and see what can come from there? So we also have to do that. And of course, there's a repositioning we need to all, as everyone here, to be that ambassador to your constituency, to your representatives out there where you work. I'll probably have to stop here, but I do want to say finally, in terms of collaboration, the various collaborations that do exist, what I've seen succeed in some climes are those little bits. Identify those champions, create them if you will. There is this one person, he may be your driver, hello? But he has the keys to the Emir's palace to help you push an agenda. Those are the champions you should seek here and there. Let's start. There is nothing wrong in days of small beginnings. Should we be here? 1,000 times no. But can we reset it? That reset starts today, and everyone here is that reset maker. Thank you. I'll probably stop here.
Thank you very much. Well, there it is. And I'll say the Alma Ata Declaration. The Alma Ata Declaration, rephrased, reset, and now being rescaled as a challenge for everyone. How did you put it? In that intersectoral collaboration, everybody must be seen to rise up as a champion to the challenge. Because one person can make a critical difference to deliver critical interventions for CRI, critical rescue interventions at every level. What is primary to healthcare is a primary legislative intervention. And I believe so many of us, including me now, are really being challenged to come into the fray and present ourselves for that kind of office where we become visible voices for issues that are actionable simply by our own committed patriotic delivery for this. It starts small and it always grows tall. As an entrepreneur, I've understood this. Start-up business doesn't start as big business. It starts with a principal investment that looks like a small thing. But if you can push it and sit with it, it will eventually become the expression, not just of an activism, but as a very real value chain that makes all the difference. Today we're here at the Francis and Felicia Umenyi Foundation. This is an inaugural conversation. It's not even so much a lecture, as more as it is a very deliberate call to action, not as children, good children of great parents, but as great Nigerians. O God of creation, direct our noble cause. Guide our leaders. We are the leaders. In the now, in the fray, in the moment. Yes, it's all not there. But who is here and now? We are. And we are the principal, primary representations of everything that can, must, and will happen if we align and make it a choice. A choice by our votes, and a choice also by our voice for voices speaking. For voices speaking become visible and become deliberate. So, having said that, it's been my pleasure to have served in this capacity as your moderator and become even more enlightened, and I would say even more, as our youth would say, ginger, about engaging not just a process, but indeed of delivering a polity to a promise. And this is a promise we must all make ourselves, that we are going to become the differentiation, having heard what we have heard today, or learned what we have learned here today. In hearing, let us hear and become not just actors. I love to say, become avatars. Let's become avatars and truly strike a path of transformative change for health and for the right of everyone who serves in that space. We are all part of a compassionate network. Collaborators, not with the medical degrees, but with compassionate pedigrees. And we can do this. So thank you very much. Please help me appreciate all of my very distinguished panelists. And we'd like to invite Dr. Chito to please come up stage. Dr. Chito, this has come from your heart, and we're good to see that the investment of your parents in your education has produced a legacy result. So this is what happens when diaspora comes home to make a difference. Because for both herself and her husband, this has been sacrificial. And for the family, it has been absolute. A full connection, and one that we celebrate and congratulate you for. So, so since it's for the whole family, then I think you should come and stand with everyone. Chito, everybody, and let's take our pictures with you. Thank you. Thank you very much. So, any comments rounding up what we've done? Thank you, and then invite everyone up. Thank you.
I've never been speechless. That's what I'm caught unaware. Thank you so much for here, and I know that family we're going to be doing the closing remarks and all that. But I think one of the great things that has happened here that we've had solutions and calls for collaboration and partnership. We've shown people that it's doable for us to come together to solve problems, and I love that even Dr. Dan Fulani is here because I think the biggest issue is the affordability of healthcare too. Like there's well, I'll say he was a presidential candidate or nominee in the U.S., Bernie Sanders. He said something that's really stuck in my mind. He said, we all have assets, right, to buy a $10 million home. We have access to that, but we can't buy it because we can't afford it. And what he's saying is that even if the hospital is next to your door, if you can't afford it, you still can't access health care. So I think with the Legislative Act, protecting patient rights, and when people talk about the private health sector, I just have to say one thing, because I am also in the private health sector, is that it is very difficult for us sometimes to make healthcare affordable. Because, as you know, everything we use is imported. And so when the economy is down, we're struggling. And that's something that's very significant. We don't get subsidized, we don't get incentives. And when it comes to NHIS, we have a lot of issues there also with tariffs and stuff like that. Quality care is expensive. And so therefore, it does need government, it does need legislation. And I think somehow we've come to that point here, and I'm very happy, and I believe the conversation has not ended. I think that the communique will be shared to each person, and if you have your email and you're interested for that, you can also reach out to us. But each of the speakers will get a communique of this meeting, and hopefully we'll be able to partner and do more. Thank you so much.
Thank you very much. I'd like to say thank you very much to Rocky Peter Agbese, the distinguished Pastor Toy Matthews, Engineer Temba David Nongo, Unguren Norogo, Barrister Kenny Umenyi, Letitia Bertrand, Shedrack Osiage, Barrister Anthony, and Barrister Chinyere Ufere, who have become our in-house advocacy groups. This I shall be submitting to you, and they shall be meeting you immediately after this. Thank you so much. Yes. Okay. And we're about to read the communique. Okay, so maybe I'll hand over to Reward at this point. We'll take closing remarks, and then we'll do the pictures. Thank you.
All right, ladies and gentlemen, can we please give a round of applause for our panelists as they go back and take their seats? Thank you very much. Hello, hello. At this point in time, ladies and gentlemen, I'd like to take a few recognitions before we move on in with the program. I'd like us to recognize the presence of a National Commissioner of INEC and the founder of CONAC Foundation, a great supporter of this cause, Mr. Kenneth Ukagnu. It's a pleasure to have you. Thank you very much for being with us here, and we recognize the work that you do. Thank you, sir. We also would like to recognize the presence of the Director General of the Hospital Management Board, represented by Mrs. Ellery, who is also the Director of Nursing of the same board. Thank you very much, Madam. Appreciate it. Sir, would you like to share a few words? Yes. Right, just a few.
Good afternoon, everybody. I want to start by apologizing for coming a bit late. And I want to appreciate everyone that is here for coming. This is actually a family thing, and I'm part of the family. I didn't know I'm going to talk. I thought Chito has spoken on our behalf. But I want to encourage everybody. I wasn't part of it from the beginning, so I cannot actually say how the discussions flowed. But whatever be the case, I trust that we are living here with some positive things, and we are going to work on those things. On our part, on my part as the founder of CONAC Foundation, we'll continue to support Francis and Felicia Umenyi's foundation. And as part of the family, as a person, I will not stop supporting the vision of the foundation. So I want to say thank you to everyone for being here. I believe that someone will take the closing remarks later and the vote of thanks, but all the same, I want to say thank you. Thank you for honoring us, and God bless you.
Thank you, sir. Thank you very much indeed. Please, let's keep the round of applause going as we welcome for the closing remarks, Senator Dr. Ugochukwu Uba. Sorry, excuse me. There's a lot is going on simultaneously. Please, I beg your pardon.
We'd like this day we have Kunitiese. I hope I said that correctly. We have Umenyi Eku and acting from the NG, Nwugu acting. We have Judith Emembolu. We have Rosemary Etienne for CONAC Foundation, Eniogon, Elias Ubo, and Rufus Oba. And from leadership, we have Abubakar Yumisa. Thank you very much. Please, immediately after the closing remarks, or once we're done, we respectfully ask you please to also, I would say that on this side of the room, we would have the action group in terms of the advocacy going forward, and on this side it will be for media. Thank you very much. Thank you. Reward? We're about to read. Okay, I'm going to read the communique.
Have you ever felt like nobody was there?
So, I'm the reward. What do you say about scenarios like this? You go from moderator to the communicator, communicator. So we shall do this.
Yes. So please, we will be, can you please just give her a round of applause as she goes down to sit on the podium once again.
Okay.
And so that she can read the communique for us. Can we please have the communique and the laptop or up over here so that that can be done and we can go to the closing remark and the vote of thanks.
Once the communique is read, the ayes shall have it. Please, how many ayes can I anticipate in this room? All the ayes? All right, we have it already.
I think today it's been a very interesting afternoon. This is the most action, I'm sure it's because you are the one that handled this session. This is the most action-oriented panel that I've ever been. I've been emceeing events for more than 15 years, and I have never...
15 years already? Yes, more than 15 years. Oh my goodness. That almost makes me wonder just how... I think Dr. Golden, I think we have to join in that golden expression. But you know, we thank God for all of the amazing interventions here today. When Martha was speaking, Levitt, she spoke about serving the underserved communities, working at ward level where people are most vulnerable, and that the only way to turn the indicators around from preventive to curative status has to be a holistic ward level approach, strengthening existing systems. And she pointed out, you know, that even though she was here representing as an expatriate what is the architecture at that level of primary healthcare intervention, her entire team numbered nothing less than 250 Nigerians of dedicated, committed medical practitioning intervention. And we should really celebrate ourselves for that. I know right now in Nigeria, there's so much of an exodus of our young medical brains leaving this country. But the truth of the matter is, we will trust that we set up an intervention that will bring them home. Not to return entirely, but you know, SDG 11 talks about global partnerships. It is a collaborative partnership that comes through the attenuated expertise that as they leave, they go to be trained up in, and they come to deliver here. Another interesting anecdote out of this event for me is the experience of Babatunde Rekura and his reading information of the newspaper of his suya purchase on a trip. From that peppered document, that is where he ended up with the peppered them action that brought that pharmaceutical global concern to a point that right now he said it is, what is it, $18 million and still counting. And the fact that it has cost them that to turn around what for them had been using children in Nigeria, in Kano State, as experimental lab rats for a drug that, though tested here, could never have been afforded in the communities where the test was carried out. All because his driver and his aide stopped to give him suya on a drive in our own hemispheres. You never know where your impact for change will come. Go on. So you see, we're going to be very practical about this. Like we said, if they cannot come to the facility, go and serve them where they are. I'm going to serve the communique. Oh, it finally made it here.
Yes, the
Okay.
communique made its way. Distinguished ladies and gentlemen, please, I'd like to do some very extremely important recognitions. Francis and Felicia, we had family members who were here, who've been here from the very onset of this event, and it will be great disservice if they are not properly and duly recognized. We have Senator and Mrs. Ugochukwu Uba. Shall we please recognize them with a resounding round of applause? Thank you, sir. Thank you for taking the time to be here. We appreciate this. We also have Mrs. Obiageli Iku. Shall we also recognize her with a round of applause? Thank you very much, madam. We appreciate you. Thank you very much. We also have Senator Andy Uba, who was here earlier on. We'd like to thank him. Please, a round of applause. Appreciating his presence, we'd like to recognize Mrs. Chinyere Dim. Shall we also recognize her? Thank you very much, ma. Thank you. We appreciate you. And Chief Mrs. Chris Uba. Please let us recognize them with a resounding round of applause. Thank you. Thank you for taking the time. It's a very busy family to be here to recognize and honor our family. Thank you.
Thank you very much for all the distinguished attendants and, of course, the very special relationships that are present here in the room. This is the communique. And, of course, the building blocks going forward from here will continue to enumerate themselves. But principally, what we are stating is this: quality health care is not a privilege. It is important for everyone, regardless of age, gender, race, religion, tribe, socioeconomic status, and or level of education. The right to health is articulated by the World Health Organization as being the enjoyment of the highest attainable standard of health. In Nigeria, the Patient Bill of Rights, PBR, as produced by the FCCPC, enumerates a list of guarantees for those receiving medical care. While the PBR guarantees patients' rights to quality health care, many interpreted this to referring to quality of care at the facility only. There seemed to be a gap as it did not properly capture the vulnerable population, more than 60% of the populace, who do not have access to healthcare facilities. In essence, it would seem that their right to quality healthcare was and stands as violated. The Francis and Felicia Umenyi Foundation, FFUF, therefore put together this forum to address the PBR with regards to the right to quality health care, to discuss core areas that need to be addressed to move towards ensuring that this fundamental right is protected for all. The forum, held this 24th day of February 2022 at Abuja, the Chelsea Hotel, was well attended with key presentation and enthusiastic participants drawn from the legislator, FCCPC, National Human Rights Commission, FCT Health Insurance Scheme, USAID, IHB, World Health Organization, medical practitioners, and other committed, interested stakeholders. The forum was interactive and addressed a myriad of problems and consequent solutions to matters connected with creating adequate access to healthcare, particularly by the vulnerable population. In summary, therefore, this forum addressed the following issues. 11 issues. 1, that our national indices on healthcare is poor, way below global standards and expectations. 2, that access to quality and affordable healthcare is sacrosanct for all, without prejudice to circumstances. 3, that there is a need to review the PBR or at least provide expatiating addendum 2, recognizing the needs of the vulnerable population. 4, that these amendments / additions to the PBR should accommodate the challenges of health facilities, that is, public and private sector, in providing these facilities. 5, that there is need for improved access to health facilities. 6, that the health insurance schemes, both the national and state level, offer a veritable tool to expand coverage to healthcare. 7, that these health insurance schemes need to be properly marketed through enlightenment programs to enable private persons and entities to participate. 8, that communities at all levels, town unions, churches, family unions, and so forth, should strengthen their ownership and alliance of health care. 9, that more funding should be provided for community-based health care. 10, that we should promote the Adopt a PHC primary health care program for corporate and NGO adaptation. 11, that there is need for legislation to guarantee that these rights are justiciable. And 12, that 2 action groups were inaugurated. Action 1, advocacy, and Action Group 2, media. Any other interventions, corrections, or observations, please? The ambassador applauds. So those in support? Any other voices? The ayes have it, therefore. All the ayes have it? Then please let me hear the ayes go with an applause. Thank you. Thank you very much.
Thank you very much. Please give her a round of applause again as she leaves the stage. Our moderator, who has done more than moderate, she's motivated and moved and started a movement simultaneously. Thank you very much. Distinguished ladies and gentlemen, please permit me to invite a very special person to this occasion to come to the microphone as he gives the closing remark. Shall we please welcome the very distinguished Senator, Dr. Ugochukwu Uba, for the closing remarks.
Good afternoon, distinguished ladies and gentlemen. Well, I have to stand on existing protocol and must state clearly, this is one of the few conferences, seminars I've attended in which solutions were found and implementation started immediately. I did a lot of them, and I participated in many. But before I go on, I must start by saying that Francis and Ifeinwa, Felicia, will be very, very happy wherever they are today. Because of what their children are doing. When I was invited for this seminar, I didn't really know what to expect. But after sitting here and listening to the informative discussion and what was said here, it means that Nigeria increasingly, in every sphere of our life, are getting worried the way things are going. And we must change them. But before I go further, I must say that Francis, I will start with Francis, is a very special person. He's like a senior brother to all of us. He was more than an in-law to the family. My late father wasn't joking with him. He's always looking after him. And he in turn, was also looking after his sons and daughters. So it was like a family. So what is happening here is not even surprising. He loves the country, Nigeria, and the children has also demonstrated that. Because I remember when I finished my PhD in Canada, I came to him and told him, look at the offers I've gotten. I've been invited to work here. I was invited to teach here. He said, no, Ugochukwu, you must go back to Nigeria. We have a lot to do. And that was when he was so anxious to establish the Faculty of Medicine at the University of Calabar Teaching Hospital. He was at the center of it. He was very eager. And he also convinced me that we must go. So I know a University of Calabar will not forget Francis in a hurry because of the role he played in getting that institution, not the institution, the Faculty of Medicine established. On the part of the wife, if he is somebody who takes care of everybody's problem, at times avoiding dealing with her own problem. So both of them were a wonderful combination. And that's why I'm very happy what the children are doing in memory of their parents. We thank God for that. Why we have children is that when we leave, we are sure they are doing something to immortalize us, or even by their action or behavior. You know, they are doing things that people will look around and say, well, Francis and Ify left a great legacy as they are leaving the world. But I must also go on to thank all those who participated, starting from the Deputy Senate President, who sent the representatives. Then also the DG of Consumer Protection, who gave the key lecture. What is even interesting in his lecture and his presence here is that only very few people still interact with organizations which they have served in. Some people don't even have the guts. They are so afraid to go near because of the record they left. But for the organization you served in to still deal with you, and for the DG to come here, we tell you the type of person Umenyi was, Felicia was. It means that she also left a legacy in consumer protection. And wherever she is, I know she's with the Lord. She'll be happy looking down at us. I must thank the DG, also thank Mrs. Levitt, because of the informative lecture he gave us. So much is happening in this country, and most of us did not even know it. So we found out today. You know, I was not aware what she was saying today was new to me, and I'm glad such things are going on here. But the important thing is that the discussant, we are dealing with a very important aspect of our life, which is the primary health care. It's totally not even in some were talking about 5% of communities in Nigeria. They don't exist. Government spent money trying to build primary health care in 774 local governments in Nigeria, but today none of them is existing. And it's my own contribution to say that if we want primary health care to work, we must have to commit the community to be part of it. They must have a stake. They must have a stake. At a stage in my career when I was in charge of rural electrification, I would then tell the governor that before we go to set up any rural electrification setting in any place, we must get the community to have a stake. Even if you are going to spend 5 million, let them put 100,000. Because if they put 100,000, they will own it. But when you just come there and build it and walk away, it's government. Government belongs to nobody. And this is the only country in the world, I don't know of any other place, where what we call utility facilities are vandalized. It doesn't happen anywhere. You may be sitting in your house and the light will go off. You think that it's NEPA. Somebody has carried the transformer. It happened to me. As a young lecturer at the University of Nigeria, one night we were just sitting, the light went off. So we were all relaxing, thinking that it's NEPA. The next day there was no light. The next week there was no light. Almost a month. So when we made inquiry, it means that the transformer has disappeared. Don't engage communities. They will not guard those anything you are installing. They also played a wonderful role at our demand. So I thank them. And so discussion we had this night. We had this afternoon. The communique is here. It's not easy. Finished presentation, communique presented, which means that this is an action. What's the other one? Legislation. We thank God for that. To God we give the glory. I will also thank the children of Francis and Ifeanyi and Felicia. I call her Ifeanyi. So I thank their children. It's not easy what they did today. I must tell you, I'm so impressed. Very, very impressed. They left an indelible impression in my mind. I know what they've been doing. They've been going to outreach and what have you, but what they did today, for me, is something I remember for a long time. Nikki Flynn, where is Nikki? Huh? She flew in from US for this function and drove straight to my house. Came in from US last night to be here today. You know. So, Nikki, you're welcome. Huh? It shows the love you have for your parents. So, but more importantly, I must also thank the discussants. You know, these are very prominent and individuals that have excelled in their various disciplines. But they are here. They have the patience. Sat down, finished, didn't walk away, and they are staying till the end of the function. It's not easy. I attend functions. I don't see this type of. By the time you finish, most of the panel they are gone. You know, but they are here. I must also thank the moderator. She did a wonderful job. Because it means that when you have this type of function, you look for her so that you will achieve result. At least we have a result today to celebrate. So I thank all of you. I pray that those that I've forgotten to mention, please, it's just an omission. You know, that God will lead all of you to your various destinations. And what we did here today will not be in vain. You know, there must be a result. I thank you, all of you, and God bless you.
Thank you very much, distinguished, for your comments and your many deep wells of wisdom that you've just shared with us. We appreciate that. It will be about time for the panelists to begin to, like to call the panelists to take their pictures. If they are still around, just come on stage and get the photographer. And while that is going on, I'd like to invite the son of the couple, Francis and Felicia, to come and say a few words as the photographs are going on. Please welcome Barrister Kenny Umenyi.
Good afternoon, everyone. We're overwhelmed and humbled by the love for our late parents, the love for our foundation, and the love for us. We never expected this turnout. We invited everybody, but we didn't expect to see this crowd, this commitment, and this love, and we were motivated to try and implement and do more and make this patient Bill of Rights an act of government before 2023. I would like to thank the Executive Secretary, Mr. Ojukwu, for coming on a short notice. Our great Konark Foundation founder, Honorable National Commissioner, the latest Honorable National Commissioner of INEC, record-breaking, first director to become a commissioner. Thank you. Alhaji Adekule, Oga Amos. My mom's lovely siblings. I can't say anything else because when our chairman Walter in the back, I can't say anything else because when intellectuals gather, everything has been said. The grammar and English that has been spoken on this stage, there's nothing I can add. It's just broken, I should be using it at this stage. But we're so happy. Today is my mom's birthday, and we wish her she would have been 72 today. But I'm sure they are dancing in heaven based on this love that you guys have shown. It's only God's hand that can be in this, for this turnout. This is not normal. When you see grace of God moving, you can tell. And I thank you all. I love you all. My siblings, you guys are the best. You guys are everything, because without them, I don't know how we would have gotten through this. Very strong women. I love all of you, and God bless you.
Thank you very much. So the panelists will take their photographs now, and after that, the family, the panelists, very quickly. You can. Where's the photographer? Where do you want them? Photographer? On stage, yes, please. Immediately after the panelists, the family will take.
Have you ever felt forgotten in the middle of nowhere? Have you ever felt like you could disappear? Like you could fall and no one would hear? Well, let that lonely feeling wash away. Maybe there's a reason to believe you'll be okay. 'Cause when you don't feel strong enough to stand, you can reach out your hand.
All right, thank you. Please, I'd like to request the family of Francis and Felicia Umenyi to please come. Yes, please, sir. Yes. Yes, please. The distinguished Uba family and all the families of...
Even when the dark comes crashing through, when you need a friend to carry you.
So please, the family, please can we come to the... Then please remember, the action group is on my right and the media group is on my left here. Please just take your positions to meet immediately. But right now, the families of Francis and Felicia Umenyi, not the children yet, the extended family, then the brothers and sisters, and they will go in. You know, the stage might not take everybody together. Okay. Please, I need some hands, ushers, I need some hands on the stage to move some of these chairs so that we can take.
crashing through when you need someone to carry you. When you're broken on the ground, you will be found. Let the sun come streaming in before you rise again. You will be found. You will be found. Crashing through, running. You will be found. You won't stop your way.
All right, the Umenyi family, please. Then after that, the foundation. All right, the foundation. The foundation. All right, the team, the core team. Foundation.
Have you ever felt like you could disappear? Like you could fall and no one.
Foundation, please. The team, the core team, can you please get up stage and take your picture? And Konak Foundation will join after that. He's coming now. Okay. What? All the people wearing the t-shirts, please come. Konak Foundation, come out too.
You'll be okay. 'Cause when you don't feel strong enough to stand, you can reach out your hand.
And someone will come running, and I know will take you home. Even when the dark comes crashing through, when you need a friend to carry you, when you're broken on the ground, you will be found. So let the sun
Everybody with a t-shirt, Konak Foundation and Umenyi Foundation, can we please get up stage? Only all those with the t-shirts, please, can you come up stage now? T-shirts only, all those who are wearing the t-shirts.